First question, please. Millions of dollars, many collaborations, various mental health, addiction, and social services. The traditional service model is not working. Why not? Especially for African Americans in affecting the disparities in the social determinants of health. Why isn't it working? Does anyone want to try to tackle that?
I can just say for a minute what we see. I think it's because we have this one way of doing business for a lot of folks. We want people, you have to go to your doctor, and you have to go in for an appointment, and you have to call on the phone, or you got to go to my chart, and you got to schedule it. That doesn't work for everybody. And I think it's difficult. Plus, folks have complicated lives. I mean, I got up this morning, I took a shower, got dressed, and I could get in my car and leave, and I could eat breakfast if I wanted, and all was good. Not everybody has that. Not everybody gets up in the morning and just go where they need to be and have all these resources. So I think our delivery model is very, very, very one-sided. It's meant for folks who can just do whatever they want when they want and have 3 hours to kill in a doctor's office. And a lot of folks don't have health insurance. That was evident. I can't tell you how many people during COVID said to me, listen, lady, I'm all about helping not spread the pandemic, but I'm telling you right now, I won't eat or my kids won't eat if I don't go to work today. So tell me how to stay safe so I can go. And that's the reality of how folks live. And I think it's hard for all of us to understand that when somebody, tries to go to a doctor, it's tough to get an appointment sometimes, and it's hard to follow that model. Then you have to go and you're going to try to, go and tell somebody your deepest, darkest secrets and feel very, very vulnerable when, in fact, you don't even know this human. So, I mean, there really has to be a different delivery model. My 2 cents.
And I didn't have much to say, but now I do. I think that when we look at the situation, going back, we have to acknowledge the inequities that we start from, right? And so, it is not easy to be in poverty in this country, right? And maybe the social service safety net, we are also grateful for it. We appreciate the work that is done by so many people every day. But it is not getting people back to a baseline of decades of disinvestment and generational disinvestment, generational trauma, right? So, I mean, the answer to that is not to throw the thing out, it's to help improve it. And then I think it goes back to the point that was made earlier also, which is that we have to, in everything that we're doing, we have to check ourselves and make sure we are not trying to do things to people and absolutely try to do people with people, right? And sometimes we have to check ourselves on that.
It made me think about when they said people of color, black people, what's going on in the number. One of the things I believe is missing is we have to have people who look like me to talk to open up. And I think that we have to be willing to hire people. Companies, corporations need to hire people despite their, what they have done in their past, and not hold it against them, but give them a second chance. And then you will have more people of color working in their places and leading them places. So I think that is one of the big problems we have in our community, not only in our communities, across the country. And I think that is one of the biggest problems that we have. And the other one is, you have to walk beside them. You have to love them and have a healthy support system to walk beside them and not have that split moment of looking down at them because of where I live or what I come from. And because with that, I know it's doable. We talk about opioid addiction, thank God, over 30 years, right? Myself. So, I know it's doable. I see people in this room I know went through it. And they're here today because they want to support Open M. So it's doable, but we have to put ourselves around people who understand where we come from. And every time just walk into a doctor's office is not necessarily the place. It may be a clinic. It may be a clinic. I don't know. But I know that in every organization who's getting millions of dollars, they may need to be looked at. What is you doing to be able to help? What is the numbers? You know, I mean, that's where I look at it. You know, when we talk about addiction and opiates, we watch our bed number change 5 years ago from that because of the opiate addiction. You know, before that, it was a crack addiction, but we didn't have as much attention on the crack addiction as we do on this opiate. So it can happen. I think if we come together again, once again, I'm going to say it, working in partnership, not and be willing to open up, we can make a change in our community.